Today we're going to be discussing the second part of our lecture on hypertension. This part of the lecture is going to focus on educating our patients on ways to manage and prevent their hypertension. I'm just going to start by showing a short video on ways to educate our patients on the importance of managing their hypertension and the importance of adhering to a medication regimen and refilling prescriptions.
One in 4 new prescriptions for hypertension medications are never filled. A major problem when 70% of U.S. adults over 65 have high blood pressure, and only half of them have it under control. Even hypertensive patients covered by Medicare Part D have high rates of non-adherence, too often skipping doses, taking the wrong amount, or stopping their medication altogether. And if your patients live in the southern United States, Puerto Rico, or the Virgin Islands, rates of hypertension medication non-adherence can reach almost 60%. So what if there was a prescription for healthcare professionals instead? One that would help you help your patients avoid strokes and heart or kidney disease. It would have to be evidence-based, easy to add to your everyday clinical practice, customizable so your entire healthcare team can play a role in helping patients take their medicine. And most of all, simple, like 90-day refills, combination medicines, and coordinated pickups. Medication adherence is a complicated issue, but one you can help solve by counseling your patients to take an active role in managing their hypertension. For more tools and resources, visit millionhearts.hhs.gov. 1 in 4 new prescriptions for
Okay, so as you can see from the video, teaching our patients about the importance of medication management and adherence is essential. So one of the reasons why it's so important to educate our patients on taking their medications is because hypertension can lead to complications including shortness of breath, heart and kidney failure, blood clots, which can lead to strokes, because if our heart is not able to pump the blood throughout our bodies correctly, it will clot. And then we also need to educate our patients who are taking blood pressure medications on the importance of checking their blood pressure, and their blood pressure goal should be 120/80. So there's also non-medication management, which is just as important as medication management. And this should actually be done first prior to starting medication. So the first thing we should educate our patients on is the importance of weight reduction. Walking is a great form of exercise. We also want to educate our patients on the importance of having a low-salt diet, increasing their fresh fruit and vegetable intake, increasing their low-fat and dairy intake, increasing their physical activity, reducing alcohol intake, reducing saturated fats and cholesterols, and increasing their intake of fish. So next we're just going to do a short quiz on hypertension. So you guys all have your clickers, and I'm just going to pass out a quick handout. So this handout also encompasses the case study, and then it also has the quiz questions and answers and rationales in case you want to look at them after class. So we're just going to begin by starting the quiz, and I'm just going to read the questions out loud, and then if you can just choose the correct answer with your clickers, and then we'll go over the rationales after each set of questions. So our first question is, which is the most desired blood pressure taken as an average of 2 consecutive measurements at one point in time? Is it A, 180/110, B, 140/80, C, 130/90, or D, 120/80, or E, 80/60? Go ahead and choose your answer. And then question 2, select the true statement for the following. A, hypertension shows symptoms in most people. B, hypertension is inherited, so the best way is to take medications. C, sea salt contains lots of minerals, so it is good for hypertension. Or D, being overweight is not related to hypertension. Go ahead and choose your answer. right, so it should not be differentiated, so there's no difference between sea salt and regular salt. Alright, and then question 3. So the risk of developing high blood pressure can be reduced by, please choose all that apply, reducing salt intake, eating a balanced diet, avoiding harmful use of alcohol, taking regular physical activity, maintaining a healthy body weight, or avoiding tobacco use. Go ahead and choose your answers. Alright, and then question 4. What physical activities can help prevent and control hypertension? Please choose all that apply. Lifting maximum weight barbell every 2 weeks, jogging for 45 minutes once a month, bicycling for 1 hour for most days of the week, swimming for 30 minutes daily, brisk walking for 30 minutes at least 5 times a week. Go ahead and choose your answer. And then question 5. What organs of the body can be affected by high blood pressure? Is it A, eyes, B, kidneys, C, heart, D, the brain, E, the lungs, F, the stomach, or all of the above? And then the last question. What is the recommended food for the person with hypertension? Please choose all that apply. Is it eating more fiber-rich foods, eating foods low in salt, eating less red meat, especially processed meats, eating more fruits, vegetables, and low-fat dairy, reducing foods that are high in saturated fats, cholesterol, and trans fats, or eating more fish, poultry, and nuts? Go ahead and choose your answers. Alright, so we're just going to go over the correct answers. So for question number 3, it looks like everybody got this correct. Hypertension is preventable and treatable. The risk of developing hypertension can be reduced by salt intake and eating a balanced diet, as well as avoiding abuse of alcohol, and partaking in physical activity, maintaining a healthy body weight, and avoiding tobacco use. And then once again, the World Health Organization does recommend that we educate our patients to reduce their salt intake to less than 5 grams per day. And then for question number 4, none of you guys got this correct, so we'll go over this one. So the correct answers are C, D, and E. So apparently for adults aged 18 to 64 years, everybody needs to be doing at least 150 minutes of moderate aerobic physical activity throughout the week, or at least 75 minutes of vigorous, intense aerobic physical activity throughout the week, or an equivalent combination of moderate and vigorous intensity. Alright, and then for question 5, the correct answers are A, B, C, and D. Half of you guys got this right. So hypertension does increase the risk of heart attacks, heart failure, strokes. It can impair our visions, and it can make our kidneys fail. The higher the blood pressure is, the higher the potential of these consequences to the heart and blood vessels in the major organs, especially the brain and the kidneys. And then for question number 6, all of you guys got this right. But of course, we need to educate our patients that they need to be eating fruits and vegetables, low-fat dairy, foods with complex carbohydrates, low-fat foods, and foods that are low in cholesterol and sodium. Alright, so that's the end of our quiz. And next we're just going to do our case study, so if you guys will participate. I have a case study in front of you, and then once again the answers and rationales are on the back just for your information. But so today our case study is going to be on Bill. So Kayla, will you read about Bill?
Bill is a 48-year-old self-employed plumber who sees occasionally for recurrent cough and upper respiratory tract infections. He has no significant past medical history, is taking no medicines, has no known allergies, is a regular smoker, and has been since his teens, drinks a couple of stubbies a night and a bit more on the weekend. Bill has come to see you for another cold that has gone to my chest. You note the nurse's observations are temperature of 37 degrees Celsius, pulse rate of 78, regular blood pressure at 148/94 and blood pressure 144/92.
All right, so our first question is, so once again, Bill is coming to see you for another cold that he states has gone to his chest. You note that his temperature is 37 degrees Celsius, his heart rate is 78, his regular blood pressure is 148/94 on the first check, and 144/92 on the second check. So my first question for you guys is, do you think Bill has hypertension? Delaney?
Yes.
Okay. Is it hypertension or pre-hypertension?
Pre-hypertension.
Good. Cool. All right. And we'll go over the answers and rationales right after this. And then question number 2. Do you guys think Bill needs medications to lower his blood pressure?
No.
Good. Lifestyle changes.
Yes. He needs to stop drinking and smoking.
Yes,
Bill.
And then question number 3. What should be the first choice hypertension medication or combination of medications for Bill? This is gone over in the first lecture. It's okay if you guys forget, and we'll go over it on the next slide. But most of the time medications can include ACE inhibitors or a combination of different hypertensive medications. And then our last question is, what blood pressure would you tell Bill should be his goal blood pressure?
120/80.
You guys did awesome. And so our answers for question 1. So Bill may have hypertension, but his blood pressure parameter, while his blood pressure measurements are slightly abnormal, we would need to do a lot more investigating to determine if he actually has hypertension. We would need to take multiple blood pressures, and we would need to gain a history from Bill. And then for question number 2, if his hypertension is confirmed from multiple blood pressure measurements, you are correct, we should begin to educate Bill on lifestyle modifications. After he completes these lifestyle modifications, we should encourage Bill to follow up with his primary care provider and to do weekly blood pressure checks. If his blood pressure remains high, then we would consider medication management. And then for question number 3, an appropriate medication would be a low-dose ACE inhibitor, an angiotensin II receptor blocker, or a calcium channel blocker. So these medications can include Coreg, metoprolol, and lisinopril. And then for question number 4, so of course our optimal goal for Bill is 120/80, but in the healthcare field, as most of us know, 120/80 is rarely achieved. So according to the American Heart Association, Bill should aim for a blood pressure of less than 140/90. All right, guys, so just in summary, so we need to really educate our patients on the management of hypertension, including medications and lifestyle management. We also really need to encourage lifestyle modifications prior to medications, because the lifestyle changes are essential for preventing and managing hypertension and preventing comorbidities. And then, of course, through this lecture material, you've gained an understanding of hypertension, which can be used to assist in educating your patients. Do you guys have any questions? Yes.
Where can I learn more?
You can go online to the American Heart Association. You can also go online to the World Health Organization, and they can answer your questions, or you can see me after class.
Awesome. Thank you.
Yes.
Do they have a high diet of fish because of the complex carbohydrates, or is it because of the triglycerides and the fatty acids?
Triglycerides and fatty acids. Mostly, fish doesn't really have any carbohydrates.
Oh, duh.
All right, any other questions? All right, guys, thank you for coming. See you next week.
Thanks.
Thanks.